technician is taking samples from this man. He's a resident of Barangay Tatalon in Quezon City. Parts of the village where he lives are under a lockdown due to rising cases of COVID-19. With or without symptoms, residents there need to be tested after a cluster of cases was found as a result of contact tracing.
Meron ng 3 or 4 or more than cases doon sa isang specific street, sitio, purok o baryo. Nakita namin doon sa address nila na ganito, na tabi-tabi sila. Kaya nalaman namin na, meron, dito sa area na to, sa street na to, meron nang nangyayaring clustering.
Contact tracing is a critical and yet complex health investigation that's badly needed in a pandemic. And much like any investigative work, the contact tracer is up against time and a host of other challenges. It begins with finding the names of everyone with whom a COVID-19 patient has had close contact in the 2 days before symptoms showed up. To be more specific, people who were around a patient for at least 15 minutes but failed to maintain 1 meter distance. People who were around a patient in an enclosed space for at least 2 hours. Quezon City Health Officer Rolando Cruz says it's seemingly endless work.
The reported cases, incomplete yung data, no? Walang address, walang contact numbers, so yun yung nagiging challenge natin right now. So, pag binabaan namin sa lugar, wala naman doon yung tao or non-existing yung address na binigay. So, ang hirap yung ganun. So, additional work for us and then hindi namin makita yung tao.
And with a huge backlog in testing in laboratories, some patients admittedly can't remember everyone they've come in close contact with and when.
Importante na suspect case pa lang, ma-identify na yung mga contact so that they ma-advise na sila na they should self-quarantine kasi na-expose sila and then monitor for symptoms.
In-enhance pa rin natin po yung pagtitig ng vitamins.
In addition, there's really very little information to work with sometimes from the national government and hospitals. And finding them, calling them, and tracking them down every way possible.
It's actually a bit like looking for a needle in the haystack, no? Kasi sa dami ng tao, kunwari, Juan de la Cruz, hanapin mo sa Facebook, syempre ang dami nun. Pero you try to message yung mga pasok sa edad, and then medyo titignan mo, ayun, baka ito nakatira sa Quezon City.
Once a close contact is found, he or she will have to be tested and isolated. Then contact tracing starts all over again with the hope that cycle of transmission ends. There are currently 18 teams of contact tracers in the city. Not enough to keep up with the number of infections a day, and it comes with risk. Dr. Insigne is among the first contact tracers in the country. 2 months into the job, she tested positive for COVID-19. She says many are reluctant to tell the truth due to stigma on infected patients.
Yung close contact po, na kasi baka din sila baka talaga sila nahawakan din. Minsan di nila sabihin na may nararamdaman sila.
With the easing of quarantine restrictions and a possible spike in COVID-19 cases, more contact tracers are needed. The target in Quezon City is at least 200 teams by end of June. The more they are out there, the better chances that they can save lives. Caroline Bonkin, CNN Philippines.